a.m. Central African time. And we're going to be switching gears now to Gaza. That's where our focus will be for the next like 20 minutes or so, where more than 1 million people in Gaza are once again facing renewed terror after Israel issued an emergency order for civilians to evacuate Gaza City ahead of a major ground offensive. For many, escape is impossible. You have the elderly, you have the wounded, you have heavily pregnant women, and those that are left behind are effectively handed a death sentence. Now, Doctors Without Borders, MSF for short, they've been doing some really, really brilliant work in Gaza. Say what is happening in Gaza is not just a humanitarian catastrophe, but it's genocide carried out with absolute impunity. And that's something that we can all agree on at this point. You just can't escape it. It's on our newspapers, it's on our social media pages, it's on our televisions almost each and every day. MSF is warning that governments around the world, through their silence or even direct support for Israel, are complicit in this genocide. And since the war began, or since the genocide began nearly 2 years ago, there's been more than 64,000 Palestinians that have been killed, and among them, 20,000 are children. And at least 165,000 people have been wounded, while Gaza's healthcare system has been obliterated. It is systematically destroyed. So to understand a bit more about just the scale of this crisis and the work that MSF is still managing to do in Gaza, we're joined by Dr. Shamun Abubakar. He's an emergency project medical referent for MSF and is coming to us live from Central Gaza to give us, I think, an on-the-ground perspective about this very, very well-documented genocide. Doc, good morning. Thank you so much for joining us. Really, really appreciate you giving us your time and the efforts that you guys are putting in Gaza. I think they are to be commended. Welcome to News and Views.
Thank you for having me and for the introduction.
No, the pleasure's all ours. I think we can just kickstart the conversation with, MSF having described what is happening in Gaza as a genocide. Is something that, most of us across the world know and understand it to be. But from your perspective on the ground, what specific actions make this definition unavoidable?
Okay, so basically, if you look at the United Nations definition of genocide, it's an act that is committed with the intent to destroy or harm in whole or partially a group of people because of their ethnicity, religion, or whatever affiliation they have. What we see here in Gaza is in keeping with such definition, in the sense that on daily basis we see a large number of people being targeted and killed. We see humanitarian aids obstructed. People are asked to evacuate on daily basis. They will leave from this place, go to another place. They will have another evacuation order by the Israeli forces. The second thing also, most of the healthcare system is already destroyed. Hospitals are targeted. People cannot have access to healthcare. Other basic needs for somebody to live, like food, water, and so on and so forth, has also been blocked. Humanitarian staff cannot easily come in. Humanitarian supplies is difficult to have them inside. And if you look at the way Gaza is structured based on the map, it's surrounded by Israel to some extent with Egypt and then the Mediterranean Sea. So people cannot also run away. So they have to be in this place and they are targeted and they are being killed. The other aspect is weaponization of the humanitarian aid. There is this thing called Gaza Humanitarian Foundation, which is aimed to provide people with food. But when they go to get this food because they are hungry, they are being shot and they come to our facilities for treatment with different wounds on their chest, on their abdomens, on every part of their body. Another thing, if you have been following up the media, the Israeli government have been saying that they want to remove everybody from Gaza Strip to somewhere, or they want everybody to live completely to where we don't know. As it is now, the Gaza City, the whole of the Gaza City, a city that has been there for more than 500 years, is asked to evacuate and is declared a dangerous humanitarian zone. So people cannot live here and people are moving from the north to the middle area to the south. Before the war, you had like 2.3 million people. Now, out of these 2.3 million people, 90% of their land is occupied. They cannot go and
mm,
stay there safely, they will be targeted. Even the 10%, there is every day air surveillance, drones, and also targeted killings. And actually, when Israeli forces are suspecting the presence of Hamas in a particular location, whether it is declared a humanitarian zone or not, they will go ahead and bomb it, irrespective of how many civilians are going to be killed. So if you look at what we witness on daily basis, the number of people coming to our healthcare facilities with different wounds, wounded by Israeli forces, you can say this is a genocide because Palestinians are the target and they are the one who have been killed on daily basis. We see different kind of wounds that even in surgical books have not been described. And our surgeons, our staff are working day and night to see how they can save people's life for the past 23 months. The war is almost getting to 2 years now. So what we see here is in keeping with genocide based on the definition, legal definition, and also UN definition of genocide.
mm, mm. Just take us through, a day, or just take us through what a day looks like, rather, for yourself and your team on the ground, where you essentially have the health system of an entire country obliterated, non-existent. You guys are working under some really, really difficult conditions where there are deliberate attempts to block in, equipment, aid, and everything that you guys could need to make sure that you offer some kind of health services to the people of Gaza. How do you go about it under such conditions, which are, I don't think most people could even fathom how difficult they are.
So basically, getting humanitarian aids in general, be it medical supplies, food aids, and so on and so forth, is really, really difficult for us. The fact that many hospitals are destroyed, the existing equipment are no longer there, and it takes a lot of time, a lot of negotiation, a lot of blockage and counter blockage before we get some essential items we can be able to sustain our trauma hospitals, because we have trauma hospitals where we target the wounded people and we treat them. A lot of medical supplies that are life threatening cannot come in. Sometimes we have to improvise. Sometimes we have to use the little we have. Some patients we have to cancel their surgeries because we don't have this. If you also go to other humanitarian needs like water, sanitation, and hygiene equipment, all these one are also blocked. Water is, the people in the Gaza Strip, they don't have access to a good and clean drinking water because the water they were getting before the war from Israel is blocked. The reservoir of water from the ground is depleted and it's not also fit for drinking. It needs a lot of desalinization as well as reverse osmosis and other things you can do to make it drinkable, but you don't have any equipment to help you make it drinkable and give to people. And with this, it's really difficult for people to have access to good clean water that they can drink. And as a result, we see a lot of water associated disease coming to our facilities, that if you have good drinking water, you shouldn't have this kind of disease in our primary health care. So every sector you look into, you will see that you don't have the materials you need to carry your activities. When you request them to come from Jerusalem, from West Bank, or from Amman side, or from Egypt, it will take weeks to months before you have little part of it. Some essential equipment are deliberately blocked. You cannot even have them completely, and we need some of these things to save people's life.
Mm, mm, mm. I want to continue on this theme. Just the kind of work that you guys are doing and the difficult circumstances that you're facing. The MSF, noted. I think I read on your website that there's about 12 of your colleagues, that have unfortunately been killed. And one of your surgeons, Dr. Mohammed Obeid, if I'm not mistaken, is currently detained. How are your teams coping with these dangers while still choosing to work in Gaza, and not packing up your things and fleeing like we've seen with other organizations before?
So basically, the 12 we mentioned, that was as of July this year. So if you put the figures in August and now in September, it's much more than this 12 number of people. When we did some analysis of our staff and their families that have been killed, we found out that like 2% of the staff we are working with, they either one of their family members is killed or their colleagues have been killed. And even yesterday, I lost a very hardworking nurse in one of the clinics where we provide life-saving intervention to this kind of injuries. He was sleeping in his tent close to the clinic at night. There was airstrike by the Israeli forces, and he sustained multiple injuries on the chest, and he was taken to a hospital. We did what we could, but we cannot save him. So this is something we see on daily basis. Our staff are really at the difficult stages of their life. They lost their homes, they lost their families, and still they still come and work in the facilities. As MSF, we try to see how we can support them, giving them the necessary mental and psychosocial support and other basic things we can be able to offer with the little we have on ground. But it's really not easy for them. You can see the frustration in their faces, but they still want to help and save lives. Both the national colleague and the international staff like me, that we come from different parts of the world, on daily basis sometimes we will see certain situation. You can see somebody that you have never seen crying, will be crying why this is happening here, why this cannot be stopped, why people are being killed, why are we treating people that ordinarily the wounds they have can be prevented by asking the people outside there to stop this kind of genocide. As doctors we cannot stop it, but the people outside, the world outside there, can stop it. So this is our daily basis challenges. We see our colleagues dying. We try our best. We cannot save them because of the level of injuries they sustained and also the unavailability of certain critical items we can use to save them or to refer them outside. Medical evacuation is really, really difficult. It's also controlled by the Israeli government. So if you want to refer somebody, it may take weeks to months before somebody gets out. Even for critical cases, it will take some days to weeks before they can go to another country and be treated. So what we see here is really dehumanizing and is heart touching. No matter how strong you are, you still see some things on daily basis that you cannot control your emotions. You just have to be crying or been worried about what is happening, and you feel like, can I be able to stop this, which you don't have the power, but the people
Mm,
in power outside they have.
No, most definitely. How close are we to the complete collapse of Gaza, or have we already reached and passed that point?
So the I think we are almost, maybe I can say around 90%. As I told you, 90% of the Gaza Strip is now occupying only 10% of the land. All the hospitals in this 90% that have been working very well before the war have either been partially destroyed or completely destroyed, or people have been asked to evacuate to leave this place, and these places are declared dangerous zone. So there is nobody can go to access all these hospital, even if they are there or even if they have been destroyed. You don't have anything there to offer. So in the few places remain only few hospitals. For example, in the south and the middle area, where most of these 1 million people from Gaza City are moving, and which it seems to be a bit secure, but still even here you have a lot of attacks and killing happening. So in this area you have only few hospitals. So for SMSF we have two field hospitals. There is another NGO, IMC has another field hospital, UKMed, ICRC, and then one public hospital that is functioning there, Al Aqsa, and to some extent Nasir. But this hospital, public hospital, are also attacked. So in general, if you look at the number of people, about 2 point something million people staying in a very small space with a lot of disease and also trauma cases coming, is really something that the current health system cannot contain. If something is not done to stop this war, we will reach a point that if you go to the hospital, they will all be occupied with patients and nothing we can do to save their lives.
Hmm, hmm. Um, Doc, just on a personal note, what keeps you going? What keeps you motivated? What keeps you inspired to continue doing the work that you're doing? Even though psychologically, as you mentioned, it gets really, really difficult sometimes.
So basically, as a team, what we usually do, we try to talk to each other, our worries, our concern, and we give ourselves moral support. We listen to each other. We work still as a team, and also we look at it that if we live here, these people, the little we are able to do, although we cannot do everything, will completely collapse, and the number of deaths will skyrocket more than what it is now. So we still feel like being here with the people, supporting them, treating them is something we are obliged to do as medical doctors, as humanitarians, and we are still motivated to continue with this, but we need the support of the powerful people in the world to talk about whoever is involved in this kind of genocide to stop it so that we can all have some time to rest.
Hmm. No, most definitely. And just lastly, before I let you go, Doc, for our listeners who feel powerless at this point, watching all of that you've described unfolding each and every day on social media, on television, and reading about it in newspapers, what can ordinary people do to support humanitarian efforts and the people of Gaza today? Looking at this bleak picture that you painted, and a very, very trying time.
So basically, what I will say is for them to speak out. There is an adage which says that silence in an unjust society is a crime. And as I told you, all the system needed to sustain life for the Palestinian people strapped in Gaza Strip is no longer there, is collapsing, is going to the complete collapse. The healthcare system cannot sustain the current need. So people need to follow up what is happening from what you and other journalists are reporting and give solidarity to the Palestinian people. They need to talk to their leaders in different countries. They need to tell them that this is what is happening in Palestine. Why are you not talking about it? Why are you not asking the Israeli government to stop this? Why some of you are collaborating to support them militarily, to support them politically, and to also sell a lot of weapons to them to continue what they are doing? So people need to speak in whatever way they can be able to talk to the world to collaborate and stop what is happening here because people are dying, people are suffering, people are hungry, people don't have access to anything to sustain them to live. Now we are going into winter season. I imagine how the situation is going to be because most people stay in tents, no latrines, no access to clean water to drink, nothing. So I think everybody has a responsibility to call the wall to stop what is happening in Gaza.
No, most definitely, Doc. Thank you so much for chatting to us. Really, really appreciate your time and giving us that on the ground perspective on what's happening in Gaza at this current moment. We really thank you and your team for the brilliant work that you're doing. As you mentioned, if you guys would leave, then essentially the people of Gaza would be left by themselves without any kind of medical support because everyone else has picked up and left. So really, really appreciate your efforts, and we hope and pray that you remain safe with your team and continue doing the commendable work that you're doing.
Thank you so much. Thank you.
There you have it. That was Dr. Shamun Abubakar, Emergency Project and Medical Referent for MSF in southern Gaza. And yeah, painting a really, really bleak picture. And I think at this point, we know and have seen most of the things that he's talking about. But it's always different hearing it from the perspective of someone that's currently on the ground. And I like the point that he made and I think insisted upon that only political will from world leaders can end the genocide in Gaza. They're just doctors, and us, the people that are here watching what's happening over there, we have a responsibility to continue calling out our governments because that's essentially the only way. The man said, "Can people do something about this so that we can get some rest?" I think there's so much to read in just that one small sentence. But yeah, until then, the teams will continue to risk their lives on the ground for the people of Gaza. Some of them even losing their lives. And we just can't continue keeping quiet about it. have to continue speaking, talking, writing, being vocal, going out to the streets protesting, being part of organizations and movements. Because, especially as South Africans, the same was done for us during the dark days of apartheid. And this is not, returning the favor. It's just being human. Going to take a quick break. When we come back, News and Views continues.